Okay, good afternoon. We'll go ahead and get started. We are recording. I want to welcome you to the webinar, Lead and Copper Rule Improvement, Strategies to Strengthen Drinking Water. My name is Alyssa Knox, and I'm an Environment and Development Planner here at the North Central Texas Council of Governments, or NCTCOG for short, and I'll be moderating today's webinar. This webinar is hosted by NCTCOG and funded by the United States Environmental Protection Agency through the Texas Commission on Environmental Quality. I want to give you a little bit of background about what NCTCOG is before we dive in. NCTCOG is a voluntary association of, by, and for local governments, and we exist to address regional planning needs present within our 16-county jurisdiction. It is one of 24 regional councils within the state of Texas. As part of NCTCOG's Water Quality Management Plan program, we host quarterly webinars on water quality topics of interest. If you have ideas for future topics for these webinars, I will share my email in the chat. You are also welcome to fill out our survey that we will share at the end of the presentation to share your ideas as well there. My email is on the screen and it's aknox@nctcog.org. Okay. I want to go over a few housekeeping items before we get started. Today's webinar is scheduled to last until 2:30 Central Standard Time. We will hear 3 presentations and then there will be limited time for questions at the end. Instructions on how to submit your questions will be shared at the end of the presentations. Follow-up emails about today's webinar will be sent to all of those who've registered. If you did not register, maybe a friend sent you the link and you just logged on, but would like to receive the follow-up materials, please email me at the email in the chat, and I will make sure you get added to the list. I want to also remind you to please keep your microphone on mute when you are not sharing or asking a question to eliminate any distractions. Okay. Today's agenda, first we will be hearing from Kira Smith, who will present overview of lead and copper rule improvements, Kara Goodwin, who will share with us EPA water technical assistance, and finally Shannon Evanchek and Kalila Durand, who will present lead testing in schools and child care facilities, how public water systems can get involved. And then after that, we will have time for questions. First, I would like to introduce you to Kira Smith. Kira is an environmental engineer in EPA's Water of Office of Groundwater and Drinking Water. She leads teams that implement the federal lead and copper rule, as well as activities associated with the EPA lead strategy to reduce lead exposure to drinking water. She also acts as an advisor and subject matter expert for all things lead in the Capacity and Compliance Assistance Division. She has 25 years of experience in the drinking water industry and previously worked for EPA on the 2007 lead and copper rule short-term revisions. In addition to EPA, she has worked for very small to very large utilities and as an engineering consultant for various projects in and around Tampa, Florida. Kira is a registered professional engineer in Texas and Virginia. She received her master's degree in environmental engineering from University of California, Berkeley, and her bachelor's degree in civil engineering from Union College in upstate New York. And now, Kira, you may begin your presentation.
Great, thank you, Alyssa. Thanks everybody for joining. I'm going to talk about the final lead and copper rule improvements. Next slide, please. So as most of you, I assume, know, lead irreparably harms the health of children and adults, and it disproportionately impacts low-income communities and communities of color. Lead pipes have exposed many Americans to health-harming lead, will continue to do so until they're removed. Right now, our estimate is about 9 million homes that are served via lead pipes, or you'll hear them called lead service lines, that continues to pose a risk to Americans' health and well-being. Next slide, please. So the key messages, I will say the lead and copper rule improvements was just published in the Federal Register on October 30th. So we're official. The revisions become effective in the Code of Federal Regulations 60 days of from the publication date, and then all the rule requirements that water systems will need to comply with will be 3 years from publication, which we're saying November 1st to make November 1st, 2027, just because October 30th, I guess, falls on a weekend. So that's, just keep in mind what I'm describing here isn't something you have to do tomorrow, although there are things you can be doing now to reduce lead exposure. And we encourage folks to do a lot of those things. So essentially, what is this rulemaking? Well, it's to strengthen nationwide requirements to protect public from lead. They're supposed to be common sense, achievable, and built on actions that have been taken proactively by states and cities. There's two big things that, if you take away nothing else from this presentation, to keep in mind. This rulemaking requires water systems to replace lead service lines within 10 years. There is no trigger. It's if you have them, you must replace them. And then the other requirements focus on locating these pipes, so you can't replace them if you don't know where they are. Improve tap sampling. The second thing, like there's two things. There's replacing lead service lines in 10 years, and then lowering the lead action level is the other thing. And I'll talk more about that later in the presentation, but those are the two big things to keep in mind that this rule does. There's also strengthening public health protection through filter requirements and improving communication. Next slide, please. And so the health and benefits of the rule exceed the costs by more than tenfold, hopefully creating good paying local jobs to remove the lead pipes. We have a lot of federal funding available right now for this with the bipartisan infrastructure law and the Water Infrastructure Finance and Innovation Act, WIFIA. We also have WIN grants too, which I'll talk about later. This rule represents this administration's take on a whole of government approach to get the lead out of communities, deliver clean water, and advance environmental justice. Next slide, please. So these are the key provisions. I've already said them earlier, and I'm going to go through each one of them in the next slides. So please move to the next slide. So where lead service lines are present, they represent the greatest source of potential exposure to lead in drinking water. We have a study that was done a number of years ago that I don't have offhand, but I can point you in the direction of it if folks want to see it. But the bottom line is 10 years, they need to be out. There are limited circumstances where systems with a high proportion of lead service lines can have some deferred deadlines, but that's very specific, and it does require a lot of state determining and oversight to keep calculating faster feasible rates, or what the fastest feasible rate for replacement is. Systems have to create a service line replacement plan. This was in the 2021 lead and copper rule revisions, this was a requirement. It has been, the attorneys hate it when I say this, it's been delayed. It was going to be due October 16, 2024, but along with most everything else in LCRR, it was delayed. But now it does have to happen by November 1st, 2027, and it has to be publicly available. And we've already talked about the greatest risk and all of that. Next slide, please. So locating pipes, knowing where they are is critical to replacing them. I mentioned the LCR, the 2021 lead and copper rule revisions, known as the LCRR. There was a requirement that we did retain that all water systems had to provide an initial service line inventory by October 16, 2024, and make it publicly available. There's not a lot more you have to do with that before LCRI becomes implementable in 2027. There were going to be updates, but under LCRI, there is going to be a regular update to inventories and deadline to identify materials of all service lines of unknown materials. There is a requirement to have the baseline inventory, which is similar to the initial, with a few notable changes. submitted to the state in 3 years. Some of those notable changes from what had to be submitted last month are that this now has to include connectors. I'm not remembering what the other changes are now. So that's the big one. Lead connectors need to be. Oh, the other one is that addresses must be included. Next slide, please. Strengthening tap sampling. So in the LCRR, the rule said that locations with lead service lines needed to take first and fifth liter samples. The fifth liter would be analyzed for lead, the first would be for copper. We decided in the LCRI to say, well, you still have to do first and fifth liter at those locations, but you take the highest of whatever result you get. And you use that when calculating the 90th. This is what Michigan is doing. It makes it a little easier since labs are going to run the lead and copper for both samples. Probably it's the same method. So that's the change to tap sampling. Next slide, please. The lower action level. So the threshold for taking action in the lead and copper rule historically has been when 10% or more than 10% of samples collected exceed 15 parts per billion or micrograms per liter. Now that's going to be 10. It does eliminate the trigger level in LCRR. There was an action level of 15 and a trigger level of 10. Everyone basically said that was too complicated, so we're just lowering the action level to 10. So when the 90th percentile result exceeds this level, more than 10% of samples collected in the system has to notify the public. And that's a tier 1 public notification. That's another thing that everyone has to do now, except now it's exceeding 15. In 2027, November 2027, it'll be if you exceed 10. Install or adjust corrosion control treatment and conduct public education. Again, note, systems must replace all lead service lines irrespective of whether they exceed the action level or not. So it decouples these two requirements. Next slide, please. Supports reducing exposure at home. So this is where point of use and pitcher filters come in. Systems with multiple lead action level exceedances, and it's 3 or more in the past 5 years, are required to conduct additional outreach to the persons they serve, and they need to make filters available. There's also requirements following disturbances of lead service lines and lead service line replacements where water systems must provide filters, and these filters must be certified to reduce lead. Next slide, please. And so there's a lot of more frequent and proactive communications. There's a lot more public accessibility. One thing being the plans for replacement. There's updated health language in CCRs and public notices, which will be updating the template we put together for the Tier 1 PN to reflect the new health, and that's mandatory health language. CCRs are also going to provide information about testing for lead in schools and childcare facilities, which that is another provision of this rule. It retains some of the elements of the LCRR testing in schools and childcare, but it expands waivers, the ability to give waivers by the state, as long as it's as stringent a program. And the CCR will also inform consumers where they can find the water system's lead replacement plan, as well as corrosion control efforts the system's taking. Next slide, please. So here's the actual facts and figures and numbers on the benefits and cost. The benefits have to do with these health benefits you see here, having to do with, and that's 900,000 infants being born with low birth rate, preventing attention deficit disorder, reduces premature death from heart disease and prevent up to 200,000 IQ points lost in children. There's other things, avoided health impacts that we didn't quantify. There is a long document I can provide the link to if folks want to actually look at the benefit and cost. The estimated annual benefits came out to 13 times greater than estimated costs. So the benefits are 13 to 25 billion per year. The costs are 1.5 to 2. Next slide, please. Again, we mentioned how much funding there is right now. There is quite a bit. There's low to no cost financing in the Drinking Water State Revolving Fund, low cost financing from the WIFIA program, and then there could be others from other federal agencies and states and local governments that could be used to fund lead service line replacement. The bipartisan infrastructure law included $26 billion over 5 years. That's $15 billion specifically for lead service line replacements and an additional 11.7 of, I believe that's additional general DWSRF funding. Yes, that's right. And then I mentioned the Water Infrastructure for the Nation Act, WIN Act grants. There's about 35 million for communities to apply to remove sources of lead in drinking water and reducing lead. And that includes reducing lead in schools and childcare facilities. Next slide, please. I'm not going to talk much about the water technical assistance because my colleague Kara Goodwin has a whole presentation on it. But it's a really great program. It helps disadvantaged communities. You can request it online, and Kara will tell you all about it. Next slide, please. So this is just a list of resources that we have currently on our website. It's and I've got the link showed on this slide here, but if you Google EPA LCRI, just make sure you've got the lead and copper rule improvements, not the proposed lead and copper rule improvements, because this is final now. And you can find all these wonderful fact sheets, Q&A, and webinar presentations. There's another one coming up in November for the drinking water professional community. You can register, it's free. And I think that's it for me. Next slide, please. Yes, that's it. And if you have questions, please send them to the lcri@epa.gov.
Thank you so much, Kira. We appreciate your presentation. Now to introduce our next speaker, Kara Goodwin, as Kira mentioned, is the Senior Technical Assistant Expert with the Capacity Development Branch of EPA's Office of Groundwater and Drinking Water. In this role, Kara oversees a number of initiatives under the Water TA umbrella. Prior to this position, she spent over 6 years on the Source Water Protection Team. Before joining EPA, Kara worked on the for the Oregon Department of Environmental Quality, monitoring and assessing surface water and groundwater quality, and spent several years in watershed research. Now, Kara, you may begin your presentation.
Thank you, Alyssa. Next slide. So today I'm going to be giving you an overview of our water technical assistance programs that we've really been expanding over the last several years. Next slide. So I'll start with an overview of, what is Water TA at EPA? What specifically do we have to support lead service line inventories and replacements, and then go through how you can request assistance for your community or water system. And then we're actually doing Q&A all at the end, so hold on for that one. But next slide. So, just to set the stage here, we recognize that many communities across the country really face a gap in having safe and reliable drinking water and wastewater services. And, several years ago, with the passage of the bipartisan infrastructure law, we were looking at these challenges and made a decision to invest in our water technical assistance programs to help improve this situation and improve the water and wastewater services that we have across needs that we have across the country. Next slide. So EPA does this in two different ways and has for many years. We provide technical assistance and we also provide funding. And, with the passage of the bipartisan infrastructure law, we are seeing historic amounts of funding available to help communities make improvements to their water infrastructure. But we also recognize that many of the communities for who this assistance was really intended may not have the capacity or be ready to apply for that funding and manage those loans or grants at this point. And that's where our technical assistance comes into play. And we have, our water TA programs, which we fund through EPA grants, and we also have contract supported programs also run by EPA. Next slide. So like we mentioned, there's $50 billion in water infrastructure funding available through the bipartisan infrastructure law that was passed about 3 years ago now. And much of this money is targeted towards disadvantaged communities. Next slide. So here at EPA, we're really focused on the goals of this funding and making sure that these funds wind up with the communities helping most in need, helping them to address many longstanding infrastructure issues and also to help them address some of their climate resiliency and other, sort of new challenges that systems are facing, including like emerging contaminants and those sorts of things. As Kira mentioned, there is dedicated funding for lead service line replacement in the bipartisan infrastructure law. So that is absolutely one of the goals of this funding. Like I mentioned, tackling forever chemicals and emerging contaminants, supporting climate resiliency and cybersecurity. That's another really hot topic that we want to make sure that all water utilities are aware of the services we have to offer and doing what they need to improve their cyber resilience. And Kira also mentioned this in her presentation, but creating good jobs along with all of this work that will be supported by these funds. Next slide. So I'm going to get into some of the water technical assistance programs that we have, but I also wanted to mention that, outside of the Office of Water, EPA has been investing in technical assistance as well through our Office of Environmental Justice and External Civil Rights. Some of you might be familiar with we call them the TIC-TACs, Thriving Community. Oh, I shouldn't have started to say that. Yeah, the TCTACs. I'll figure that out later. We also have Thriving Community Technical Assistance Centers. I knew it would come to me. There's also technical assistance available through our Office of Land and Emergency Management and the Brownfields program. Our folks and partners in our Office of Congressional and Intergovernmental Relations and our office do a lot of work with local municipalities. And then our Office of Research and Development has a number of research projects that are focused on technical assistance and understanding some of the best practices involved in things like lead service line identification and addressing and treating emerging contaminants. And then finally, our sister agencies at the U.S. Department of Agriculture and the Indian Health Service also provide a lot of technical assistance, and we work closely with them in a number of different areas. Next slide. So what can Water TA do for a community? Our Water TA programs are broad and they can address a large number of different types of challenges and help to work with communities to identify and implement solutions to those challenges. So you'll see many here, but aging or lack of infrastructure, project planning and development, community engagement, these are all things that are important in the lead service line space as well. And of course, funding up identification and application support. That's an integral part of the work that we're doing right now to ultimately help communities take advantage and have access to the infrastructure funds that are available right now. Okay, next slide. So a little bit more specific on what those projects could look like. So that's kind of the type of work that we can help with. And then, this assistance is available for both drinking water and clean water and wastewater types of projects. So you'll see both of those in this slide here. But yeah, water quality concerns, identifying and removing lead pipes, treatment plan upgrades, regulatory compliance. Those are the sorts of projects that our TA providers can help water systems and communities identify their needs and address their challenges. Next slide. So we often get asked, like, who can receive water TA services? And it's a really important point here to make that our water TA is it's services that we're offering. Sometimes people contact us looking for funding, and we don't have, water TA programs do not have funding to give out, but rather we look to connect you to a service provider who can help you, with their expertise, whether that be with community engagement or treatment system optimizations or applying for applications. So, they're really, expertise, somebody that'll come and work one-on-one with your system to help you work through problems and implement solutions. And, depending on what the ask is, all of these entities here who are listed can request and receive water TA through our programs and initiatives. If the request is related to addressing improvements for a water utility, we really need somebody within the water utility to be engaged, a decision maker within the utility, to be able to implement, those solutions that we have. We can work with community-based organizations, non-governmental organizations in a facilitation role, and try to help make those connections and move forward together. But, in order to see the improvements in the water system, we need to have their buy-in and willingness to work with us. Next slide. And so who are technical assistance providers? We work with national and regional providers who have experts in water sector challenges, engineers, former operators, current operators, those sorts of things. And then, another hallmark of the support that we give is community engagement and understanding how to help water systems, and this is very important for lead service line replacement, do that communication out to your communities to understand what you're doing and why you're doing it and how you need their help. And to get their input and buy-in to make sure that the progress serves everyone. So I mentioned that, we have a lot of different programs, and, what I tell people when I show them this slide is that, EPA Water TA, that's the umbrella term that we use, and it covers a lot of different programs and initiatives. Some of these have been around for a long time. Some of these are new, having been funded from the bipartisan infrastructure law. But, what you need to know is that our services and our support covers a large variety of water system challenges. And, we don't expect you to understand the details of each of these programs and how they're implemented and how their services work. We have an online web form, which I'm going to walk through in a little bit, but you just need to request assistance. Tell us a little bit about the challenges that you're trying to address. And then on our end, it's our job to try to match you with the best program and provider that we have available. So next slide. So here I've highlighted, that's okay, go back. Here I've highlighted a couple of our initiatives and programs that are particularly relevant to lead service lines. And I'm going to walk through some of these. Now, I'll mention that the lead service line replacement accelerators pilot. So we're getting ready to wrap that up in a few months. That was a pilot initiative that covered 40 communities across 4 states to help them accelerate their lead service line inventories and replacement planning. We took the lessons that we learned from that and built that program out into a national level initiative, which is the Get the Lead Out initiative. And then these other 2 programs, Environmental Finance Centers and Training and Technical Assistance for Small Systems, those are some of our grantee-led programs that provide national level services, and I'll talk about those a bit. So next slide. So our Environmental Finance Centers, it's a program that's been around for many years, a couple decades, I believe. But with the funding that became available through the bipartisan infrastructure law, we really infused a lot of funds into that program and restructured it a little bit. So we have, you'll see here on the slide, Category 1, the regional multimedia, multi-environmental media EFCs. Those are what I refer to as like our legacy EFCs. If you've worked with the Southwest Environmental Finance Center out of the University of New Mexico, in the past, it was probably in this role. And so they're the regional EFC for Region 6 here, which includes Texas. But with the bipartisan infrastructure law, we created 2 new types of environmental finance centers that are focused on water infrastructure and funded with those bipartisan infrastructure law funds. So we have at least 1 regional water infrastructure EFC in each EPA region. And then we have 4 national water infrastructure EFCs, which can provide services across the nation. They can help fill gaps if a particular regional EFC doesn't have a certain expertise or doesn't have capacity to work on a certain project. We can try to refer them to a national water EFC. They're also doing national coordination across all of these providers and kind of working on some national resources that can be used across the water infrastructure space. And those EFCs are available to help support lead service line inventories and replacement planning, community engagement and outreach, and other topics that are related to the lead pipes. So next slide. And then this slide goes into a little bit more about the Get the Lead Out initiative, which we launched in November of 2023, so just a year ago now, with the goal of accelerating lead service line replacement by delivering technical assistance across the country. This initiative will provide communities with direct technical assistance by supporting them through lead service line records review and inventory initiation. Hopefully everyone has already provided their initial inventory last month, but they can also help with replacement planning and funding application, ultimately facilitating access to the SRF funds to achieve the goal of accelerated lead service line replacement nationwide. We also aim to accelerate progress in lead service line replacement nationwide by spreading best practices and policy innovations. So in addition to providing utilities with the direct technical assistance, we're collecting and documenting, implementing best practices, and then sharing that, as national resources available to others to learn from the work that we're doing. During our first year, we onboarded 52 communities for GLOW, including 2 in Texas in the greater Dallas area. For Get the Lead Out, we're looking at 3 indicators for the communities that make a good fit for this program. We're really focused on supporting underserved and disadvantaged communities. We also look for evidence for the presence of lead service lines. And then, of course, we need to have a willing partner to work with us on this. We're providing technical assistance. So, one of the primary goals of the work that we do is building capacity with the system. So we're really looking at doing this work side by side with the system so they can learn from what we're doing and continue making progress after our TA is complete. All right, next slide. I also wanted to point out some of the national level resources that we have available on our website that were developed through the Accelerators pilot, which I mentioned earlier. So we have 4 templates for community engagement on our website to help water systems. Sometimes it can feel overwhelming when you have to do all this communication to the public and you just don't know where to start. So we have these templates, they're Word documents, you can pull them down. You'll see where there are places for a water system, water utility to put in the information that's most relevant for their communities and their systems. We also have a needs assessment and community work plan template and a funding sources document for developing service line inventories. Next slide. And more broadly for Water TA, on our EPA website here, we have a water infrastructure website that we have this great story map. So you can see how the bipartisan infrastructure laws are making a difference for communities across the country. And in the story map, there are a number of technical assistance stories included there too. We've just highlighted one here for a community that we worked with in Michigan. And you'll see there's a little indicator at the top that this was a Water TA community. A lot of the other stories in there have to do with SRF funding as well. So it's pretty neat to click around for some inspiration. Next. And then, so the final part I'll get into here is kind of like, so how can a community actually access and connect with the Water TA services that we have available? So there's a couple different ways. We coordinate a lot with state primacy agencies and our EPA regional colleagues. So often we'll get a referral or recommendation from them about a community that could use our assistance. Our community could directly contact the Water TA provider. So on our Water TA website, which you'll see at the end, you'll see different Water TA providers there, and our Water TA providers are also doing a lot of their own outreach. So they can make those direct connections. Same, they could also be referred by other stakeholders and partners in the area. And then finally, the one I'm going to walk through now is we have this web form online where a community can directly request assistance from EPA through our online form. And then, yeah, I'll just walk you through it. So next slide. So you would start at epa.gov/waterTA and look for this blue button kind of in the first third or half of the website. It says click here to request water technical assistance for your community, and that'll bring you to our Water TA request form. So next slide. The web form should take about 4 to 5 minutes to fill out. We're really just asking for high-level information. So, we need some contact information so we know how to connect to contact you if we have questions, and then when we have a suggested TA provider to connect you with. So next slide. I'm not going through every question that's in the form, but some of the ones I think are most relevant here. So, we need some information to help us to work through and think about all the different providers that we have available and how best to match you. So we asked some questions about, what type of system or project, is it drinking water, wastewater, stormwater, a couple other options here. Next. And then at the bottom of the form, you'll see there's this box where you can fill in to briefly describe your concerns. This is the most important part. So the most detail that you could give us about what the situation is for your community and your system, the better that we'll be able to, and probably the faster we'll be able to process your request. So please be as specific about, the challenges of, what types of projects you're thinking of, or if you need help prioritizing projects, if you're thinking about pursuing funding and need help with an application, if you need help with community engagement, the more detail you can give us in here, the better. And then, if you've been working with a TA provider, that is helpful for us too. That, we'll certainly still process the request, but it helps us to know if there's another provider, and then we may reach out to them to get, some more background information as well. And then this question about disadvantaged communities, if you have, been through the SRF process before, and you know that you qualify as a disadvantaged community under those criteria, you can let us know. It's perfectly fine if you don't know. We prioritize our work for disadvantaged communities, but we also understand that sometimes it's hard to know the answer to that question. So next slide. So after a request form is submitted, it comes into EPA. We work with some contractors to help with the kind of administrative processing of things, but we connect with our EPA colleagues in your region, and we also ask them to connect to the state primacy and/or SRF agency in your state to get any more context and to understand if any other technical assistance might already be being delivered. And that's all just to kind of build the context around the request. And we get that feedback from the state and the regions, and then we look and assess out the providers and the opportunities that we have available. And we reach out to a TA, our TA providers, and we ask them if they have the capacity and the expertise to help to work with you on your challenges. And, once we find somebody that says yes, and let's go, then we'll send what we call a matching email out to the community and say that, they've been matched with this TA provider and to expect to hear from them. And then go forth and do good work. That TA provider will meet with you to assess your needs and come up with a plan to help address those needs. With the potential to help with applying for funding if that's the direction you're going in. Big caveat in red down here. Not every request may be offered water TA. Sometimes we read a request and after we get through it, we realize that you're really looking for information, and we can help provide that information. And with that, you can move on to your next steps. Sometimes there are cases where certain folks are not eligible, like we can't provide TA to federal facilities. And then also, participation in our water TA programs does not guarantee any funding on the other end of it. Like I said, we don't provide funding, but we can help you to pursue it and help you to prepare a strong application. But ultimately, especially for the SRFs, that's the state's decision, and they have their own criteria for that. Next slide. So that's all I have. Here are a couple of resources for you. Our Water TA website, where you can find that web form. There's also a direct link to the web form. And we have an email box, waterta@epa.gov. If you have any general water TA questions, maybe you have some questions before you want to submit a request. And then my personal email here is at the bottom as well. And you're certainly welcome to reach out to me directly. Thank you.
Thank you so much, Kara. That was really informative. I'm glad you were able to share it with us. Now I would like to introduce our final speakers who will co-present today. First is Shannon Evanchek. Shannon is the Director of Lead in Drinking Water Programs at Trupani, an engineering and consulting firm. She has a Bachelor of Science in Environmental Engineering from Georgia Tech and an MBA from the University of Tennessee. Shannon has worked for Trupani since 2016, and her duties include overseeing lead in drinking water sampling programs and lead and copper compliance programs. Kalila Durand is the project manager for the lead testing in school and child care program at the Texas Commission on Environmental Quality. She holds a Bachelor of Science in Geoscience from Midwestern State University. Kalila joined the TCEQ in 2022 as a natural resources specialist in the Water Supply Division, where she worked on the school and child care portion of the lead and copper rule revisions and assisted with day-to-day operations of the lead testing in school and child care program. Her current duties as project manager include overseeing all aspects of the program and communicating with various stakeholders. Now you may both begin your presentation.
Thank you, Alyssa. Next slide, please. Okay, we are going to talk to you today about the lead testing in school and childcare program that is provided by the Texas Commission on Environmental Quality. Next slide, please. So this is a program to test for and reduce children's exposure to lead in drinking water. For more information, you can visit our website at texasleadtesting.org, or you can email us at info@txleadtesting.org. Next slide. All right, we were already introduced. I do want to point out that Trupani is our program provider. And we are extremely fortunate to have Trupani providing this program for us here in Texas, as this is a nationwide program and they have extensive experience providing this program in other states as well. Next slide. All right, I'm going to give a brief program overview, and then I will hand it over to Shannon, who will talk about our program benefits, some of our achievements, our key findings, and then talk about how the LTSCC program can help you and water systems. And then we'll have question and answer at the end. Next slide. Next slide. Thank you. Okay, again, this is a free voluntary program that helps Texas public schools and state-regulated childcare facilities test for lead in drinking water and take action to reduce lead where children are served. Training, support, and sample analysis is provided at no cost to participants. Technical assistance and ongoing support is also provided so that participants can successfully complete the program, and all materials and instructions are included and delivered directly to participants. Next slide. The guidance that we follow is the EPA's 3 T's guidance for reducing lead in drinking water in schools and childcare facilities. This is a training, testing, and taking action approach to reducing lead in drinking water. Next slide, please. Funding for the program is provided also by the EPA through the Water Infrastructure Improvements for the Nation Act, Section 2107, Voluntary School and Childcare Lead Testing and Reduction Grant Program. Next slide, please. Before I talk about the steps of the program, I want to discuss what we've done to garner participation in the program. Since this is a voluntary program, we've worked to increase program engagement through various forms of outreach. One of these forms is direct outreach, in which we prioritized areas with low median household income, facilities where 50% or more of the students receive free and reduced lunch, facilities where children are 6 years and under, and Head Start facilities. As a result of that outreach, we have 72% of participating schools and 85% of participating childcares in communities that are below the state MHI. We also do online trainings, educational sessions, we attend various conferences, and we host webinars and present at external webinars such as this one. We also do social media posts, and we have a program promotional packet that practically anyone who wants to share and support the program and promote the program can have access to, and it consists of templates for letters, emails, and even graphics such as the ones on the slide. Next slide, please. Okay, so there are 6 main steps of the program. The first one is to enroll. When someone expresses interest, they will need to go to our website and enroll using our online enrollment form. For large ISDs and childcare agencies, this step can be streamlined, so multiple facilities can be enrolled at once. In this step also, the participant will have to designate a sampling event coordinator, and this will be the main point of contact for the facility as it relates to this program and pretty much be in charge of the program. After enrollment, the next step is to complete a programmatic training. This is a short, about 7-minute training that informs the participant on what lead is, the health effects of lead, sources of lead, lead in drinking water, and just about the program and what it is that we're doing. After that, they will need to notify their community. This is where they inform their community that they are going to participate in the program. This is a requirement of the grant, but we do find that it is best practice to be transparent and proactively communicate with their community, as it would reduce any misinterpretation about what is going on in the facility and what the program is about. Their community could include their building owner, if any, faculty and staff at the facility, and the parents of the children that they serve. Next slide. The next step is to complete the outlet inventory. So this is where the participant will go around the facility, usually with a smart device like an iPhone or tablet, and identify and label outlets for sampling. We, of course, encourage sampling from outlets that are used for drinking and food preparation, as other outlets that are only used for hand washing or dishwashing are not generally a concern, since lead cannot be absorbed through the skin. In this step, we do offer on-site sampling, as well as the step immediately after it, which is sample collector training and collecting the samples. So for the sample collector training, it is another short video that explains how to collect the samples and how to ship the samples. For facilities or ISDs with multiple facilities, we do find the on-site sampling is especially helpful to them. So that is an option for our participants. After that is done and the samples are analyzed, the final step is to receive results and take action. So we do send them their results along with an action plan that has recommended control measures that can be taken based on the result at the particular outlet. Next slide, please. So all of our sample protocols meet the requirements outlined by LCRI for school and childcare sampling. We do take the 250 milliliter samples. We have an 8 to 18 hour stagnation period. We take both first draw and flush sampling, and we also do multiple rounds of sampling. And also any trained collector can collect samples. It may be from school or childcare personnel, the LTSCC team, a water system, or even a consultant. Next slide. All right, as I mentioned, all participants will receive an action plan along with their results that outlines some options for remediation, and they will receive that action plan regardless of their results. Even if there is a non-detect in all of their outlets, they will still receive that action plan because it also consists of best practices that can be done. Neither the LTSCC nor the LCRI has an action plan for school and childcare sampling, but there is the 10 part per billion action plan for tap monitoring on the LCRI. Also, this is very new to the program. Since WIN funding can now be used for remediation, we do have the ability to provide drinking water fixtures and filters at no cost to the participants after they've completed sampling. Next slide. Okay, before I conclude my portion and hand it over to Shannon, I just want to encourage you again to visit our website, texasleadtesting.org. This is where, again, participants enroll online. We do also have the option for public water systems or just anyone in the general public to nominate a facility. And we will reach out to all facilities that are nominated and encourage them to participate in the program. You also have access to our public results portal, where you can see the results of all facilities that have participated in the program. You can sign up for webinars and view past webinars, view news and information about the program. You can schedule a meeting with us, and you can generally learn more about the program. There are a lot of helpful resources on our website. And with that, I'll hand it over to Shannon.
Thank you, Kalila. So I'm excited to speak with everybody today to talk about some of the program benefits and achievements, and also hopefully tie together a little bit of the information that Kira presented at the very beginning of this meeting today, since school and child care sampling is one of the requirements for water systems that's forthcoming under the lead and copper rule improvements. So some of the program benefits of the lead testing in school and childcare program, which is a program of TCEQ, are that it meets and exceeds all of those LCRI requirements for school and childcare sampling. Because this program was designed based on the 3T sampling experience, it does meet those requirements for the LCRI sampling. So, we really see this program as a way to, look at this as a two birds, one stone approach to meet both of those requirements. The LTSCC program also provides free sample materials, training, and lab analysis from a certified lab. As Kalila mentioned, we can mail sample kits to schools and childcare facilities and train personnel there to collect the samples, or we have our own sample technicians throughout the state of Texas that can visit on site for a school and childcare facility and assist them with the sample collection. We also provide technical and communication support daily. We have dedicated phone lines for any questions from schools and childcare facilities, any questions from water systems, and any questions from members of the public that our communications team is trained to answer. We also see one of the benefits of this program as increasing trust and transparency with the school and childcare communities, with the ultimate goal of reducing lead where children are cared for. Some of the new control measures that we can offer through the program, as Kalila mentioned, this is funded by the WIN grant from EPA, which was recently, able to be used for not only the sampling and testing, but also for providing control measures to help address sources of lead. So we can provide free filters and fixtures for school and childcare facilities that have completed the sampling and detected lead. We work with them to come up with a plan that works for them and can provide them with several of these devices or fixtures to help mitigate any potential sources of lead. Some of our program achievements to date. So this number is going up every day. I think, today we're over 3,400 participating facilities, both public schools and regulated childcare facilities all across the state. That impacts over 400,000 children that attend these facilities that have completed their lead testing for their drinking water. And we've collected over 28,000 samples and analyzed them across the state and sent out over 3,000 filters that are being used in schools and childcare classrooms to provide safe drinking water. Some key findings from the program, and I do see a question in the chat here. I know we're going to have some time for questions later, but I do want to answer that right now, that this is a voluntary program, but it can be used to meet the requirement for water systems to test their schools and child care facilities. So looking at some of the key findings here from the program, we have been able to reach both schools and child care facilities over the across the 26,000 schools and child care facilities across the state are eligible for this program. And so we built a list of all of these facilities to make sure that we could contact them and reach out to them in a prioritized fashion to try and identify the schools and child care facilities that, based on different data could potentially have the most lead or have students that are most vulnerable to lead exposure. So for the schools, we've noticed some trends that larger school districts are more likely to enroll at the district level and typically have teams in place that can oversee the program. For childcare facilities, we're seeing, especially for those residential childcare facilities, they're more likely to enroll individually and are best reached via letters, emails, and postcards that are most effective rather than phone calls during normal business hours where they're also busy caring for children. Some of the data that we've seen, so we have been collecting 30 samples on average per school and 7 samples on average per child care facility. For schools, we've seen about 2% of samples come back at 15 parts per billion or higher, which is a commonly recognized threshold for taking action, although we do recognize that there's no safe level of lead exposure. And then for child care facilities, we're seeing about a 1.5% rate of samples coming back at 15 parts per billion or higher. However, what is really interesting is because we're collecting so many samples at schools, and we do know that lead levels can vary between drinking water outlets. So a kitchen faucet could have a different result than a classroom faucet or a drinking water fountain in the hallway. We do see that about 28% of schools have at least one location that comes back with lead detected at 15 parts per billion or higher. So that's where this funding being able to be used for control measures is really, really helpful, because if there are locations that are impacted, we can work with the schools to help implement a solution at some of these locations. And then for childcare facilities, we see about 7% of facilities that have at least one location that has lead detected at or above that 15 part per billion commonly recognized threshold. We also analyzed the program data by outlet type. So as both Kira has mentioned and Kalila has mentioned, with the LCRI requirements that are some of these new requirements for water systems, school and child care facilities will be sampled by their water systems, but this program can be utilized as the ability to issue a waiver. And what the requirements of the LCRI say is that water systems have to collect 5 samples per school in their service boundary and 2 samples per child care facility. And there's guidelines in the LCRI on what locations need to be sampled. So locations like drinking fountains, kitchen faucets, and classroom faucets are part of the locations that will need to be tested by water systems as part of the LCRI requirements. And so we wanted to look at some of the data that we have, just because we have such a large data set. From looking at over 11,000 drinking fountains, we found that 78% were below the detection limit of 1 part per billion when we looked at all of those sample results, and about 20% had lead detected at some level and 2% at 15 parts per billion or higher. As you can see with kitchen faucets and classroom faucets, what we see in that data is that those outlet types are more likely to have lead detected as compared to a drinking fountain. We do have all of our data publicly available. So if you go to txleadtesting.org or if you go to texasleadtesting.org, both of those websites will point you in the direction of where you can access results. All of the public results can be filtered online, so you can only download a subset of the data, or you can download all of the data, and that way you can look and see what schools and childcare facilities in your area have already completed sampling and may be eligible for a waiver for LCRI sampling. So when you download all of that data to a spreadsheet, you're going to get a list of all of the results, and then from there can see a list of unique schools or childcare facilities that have completed sampling. There could also be more schools and childcare facilities in your area that have enrolled, but have not yet completed the sampling step of the program. And if you need any help navigating this website or have any questions about the data, please reach out to our team. You can reach us at either enroll@txledtesting.org or info@txledtesting.org. So I want to talk a little bit more about how the lead testing in school and childcare program can help you, especially for water systems. So speaking a little bit about LCRI compliance, and I do want to preface that when I'm talking about LCRI compliance here, I'm just talking about the school and childcare sampling requirements, because as Kira covered, there are a lot of different requirements through the LCRI. So one of the requirements for the LCRI is to begin sampling schools and childcare facilities in 2028. So water systems are going to be required to notify their schools and childcare facilities, make at least 2 efforts to complete sampling for schools and childcare facilities in their service boundary. That is going to be for 5 samples collected per school and 2 per childcare. And then the WIN-funded programs have been clarified in LCRI that they can be used to meet this requirement. And that's what the LTSCC program is. It's a WIN-funded program. So it's available now and it's voluntary. Our program, again, is WIN grant funded, so it's completely free for schools and childcare facilities. And we can sample every location that the school uses for drinking or cooking, same with the childcare facility. And that really is going to give a comprehensive look into their water quality as it relates to lead, because all of those locations can be sampled. So the bottom line is that sampling now through our lead testing and school and child care program can help with future LCRI compliance. I want to talk a little bit about stakeholder engagement. So although, this program is aimed at schools and childcare facilities, there are several other key stakeholders. Public water systems are, one of our main key stakeholders because oftentimes those relationships with school and childcare facilities already exist. And, if there are, questions about the results, a school or childcare facility may reach out to their water system. So we really want to work with you all and work with the water systems to collaborate on this program. Other stakeholders that we're reaching out to, include various state agencies. This is a program of the TCEQ, but TEA and Department of Health and Human Services are also key stakeholders on the program. We've done a lot of direct phone calls and have created a network to cross-promote the program and increase awareness and trust. So a program highlight here is we did work with the City of FAR Public Utilities to hold a program information session for over 30 child care administrators and increase the program participation in and around the area. Some of the communication resources that we have available, we have all of our materials available in both English and Spanish. We also have team members that speak both English and Spanish and can talk to any childcare facilities, schools, or interested parties on the phone and provide support. We can also help write custom press releases, custom letters to the community, hold webinars to assist with questions from the community. We really have a team that's here to work with you all and answer any questions and provide the program in a way that best works for the local community. We did recently work with Austin Water to promote the program to Austin-based schools and childcare facilities, which then led to the enrollment of Austin ISD signing up over 100 schools and also 50 childcare facilities in the area participating as well. Again, talking a little bit about our sampling assistance, we have free sampling and analysis available through the program, and this can be used for a waiver for the LCRI requirement for any sampling that was completed after 2021, which is all of the sampling that has been completed to date through this program since we really started collecting sample results in 2022 for this program. And then again, we can send sample kits directly to schools and childcare facilities that are interested, or we can provide on-site support. This past summer alone, we provided on-site support to collect samples from over 400 schools across the state. Again, highlighting this remediation support that is available. We can provide both filters and fixtures for any locations with detectable lead. We can also work with schools and childcare facilities and incorporate the water system as needed as well to talk about different remediation strategies. And we're currently also collecting remediation information for locations that have taken action. And then we can provide additional sampling as well to ensure that corrective action was effective. Last but not least, I want to make sure that everybody here today knows how to get in contact with our team. We have a helpline available. We have an email and a web page available as well. I really think the team has, really focused on making this program as accessible as possible. So for any school and child care facility that might be attending today that's interested, the enrollment process only takes a few minutes. We can also set up a video conference or complete a phone call with any water systems that are interested in connecting on how this program can be promoted to their community. And, we thank you for attending today and for listening to a little bit about what this program can offer.
Thank you so much to Shannon and Kalila both for their presentation. Now we do have some time for questions from the audience from any of our 4 speakers. You can ask your question in one of 2 ways. You can put your question in the chat, or you can use the raise hand function, and I will call on you to unmute your microphone and share your question verbally. I see during the Water TA presentation, a question came in from DJ that says, is the Texas Water Development Board the financing agency for the TA water services in Texas? I believe that they are, because I know of their support for the state revolving fund. I don't know if our Texas speakers, Shannon or Kalila, know further information about that. That's my understanding, but I would hate to steer you in the wrong direction, DJ. Kara, did you have further insight on who our state person might be?
Yeah, and just a little clarification on the question. So yes, the Texas Water Development Board manages the state revolving fund. So if you were to apply for an SRF financing to finance a project, you would be applying to the Texas Water Development Board. The Water TA programs that I was describing are funded by EPA with the money that we got from the bipartisan infrastructure law. But it also gives me an opportunity to say that many states, I believe also including Texas, use some of their SRF funds to fund their own TA programs. So everything that I mentioned that I was talking about is kind of managed and run out of EPA. But many of your states across the country also run their own technical assistance programs. And that's one of the things that we check in with the state when we get a request and we get the feedback from the state. We also give the state the opportunity to say, like, hey, we've got a great program that could help support them. And, then the state can connect the requester to the local resources as well.
Wonderful, thank you. Kara, I had a question for you. Can you speak to the timeline regarding the technical assistance? Like how far out from an application deadline should someone be making a request to get that assistance if they know they're going to need it?
You took that question in a different direction than I thought you were going to.
Oh, sorry.
I think that really depends on what needs to be done, right? If it's, just filling out an application, that'll be one timeline. If you need engineering support, which is another thing that we provide to develop, we can help support the development of a preliminary engineering report. That will probably take at least 6 months, if not longer, depending on what the project is. So, I think that's something that, our TA providers, that's what we discuss in kind of some of those intro assessment informational calls, is kind of like, what are your goals? What kind of funding timelines are you working with? And then, we can help prioritize the assistance based on those needs. But yeah, certainly. And then, different states have different timelines and different application processes. So it's not a simple, yeah, it really is a case by case situation. So,
Sure.
if you think you might need help, raise your hand and ask.
I assume earlier is always better, but great.
Yes, absolutely.
A question came in from James. They have completed their lead and service line inventory with no lead or no GRR lines found. We need to provide a statement declaring so in lieu of publicly posting the lead and service line inventory. Does EPA have standard language for public water systems to use for that statement? I don't know if either Kira or Kara want to take that question regarding a standard
Sure.
language.
No, we don't. We just have what's in the rule. It's pretty straightforward. You just say we don't have any lead or galvanized, and you sum up what sources you used and your rationale, and that's it.
Great. Any other further questions from our speakers or for our speakers? Okay. Well, if seeing none, we'll go ahead and move on. We're nearing the end of our time, and so we're going to go ahead and wrap up. I am going to put a survey link in the chat so you can provide NCTCOG with your feedback regarding this webinar. You can also click on your screen, and that should take you to the survey as well. We would want to use this feedback to increase our webinars, to improve them in any way, and this would also give you a chance to share ideas for future webinar topics. So we would really love to hear your input. Resources for today's topic and other water resources subjects can be found on the Water for North Texas online library, and that is on your screen as well. So please feel free to poke around there. We have resources related to stormwater, wastewater, drinking water. That includes case studies, podcasts, all sorts of really good stuff in a variety of mediums. So please check that out at your leisure. As a reminder, we will be sending out today's presentation materials via email to all who have registered. So please make sure that you have registered on the link so we can have your email. If you did not register, please email me at knox@nctcog.org. My email is in the chat so I can make sure I add you to the list. Thank you to everyone who joined us today. I want to thank again, finally, Kira Smith, Kara Goodwin, Shannon Evachek, and Kalila Durand for taking the time to share their knowledge with us. I found it very informative and helpful, and I hope you did too. This webinar is now over. Thank you and have a great rest of your day.